Did you know that there's a heart test that your doctor probably isn't ordering? There's an advanced cardiovascular screening. This means advanced heart screening test that can be done. So I want to tell you why standard tests are missing the mark. Most doctors only check total cholesterol like LDL, HDL, triglycerides. They're not going in depth and looking at these inflammatory markers because we know that a lot of people will leave the doctor's office saying, oh, my cholesterol is fine, and they'll still leave and have a heart attack or a stroke. Or some people may go to the doctor and they'll say, oh, your cholesterol is really high, you need to get on this statin. Do they really need to be on a statin? Well, why don't we look at these inflammatory markers a little bit more in depth and really know if you need to be on these medications or if there's other things that can be done. Because we can now go deeper to catch this silent inflammation and look at these early risk factors by doing some simple blood tests. So Cleveland Heart came out with this new lab, the Cleveland Heart Lab test, and it shows these comprehensive cardiovascular panels that show these inflammatory markers and some other markers that really tell us more about what's going on inside of you and what your risks are and then we can talk about what can be done. So this LP plaque 2 is a marker that we draw in the blood test that shows vascular inflammation. What does that mean? Well, the arteries are the ones that bring oxygen to all of our vital organs like our heart, our brain, our kidneys, our liver, our muscles, and our other organs, like maybe the sexual organs as well. Well, if these arteries are having inflammation in them, then you're going to start having problems and things will start breaking down or you won't be getting oxygen to these vital organs. So with these blood tests like the LP plaque 2, we can see if this is elevated that we really need to do some aggressive things or maybe just talk about some simple lifestyle things that can be done to get these inflammation markers down. There's also one called the MPO, which is the myeloperoxidase. This is a oxidative stress marker. And what we're talking about with this oxidative stress is that if there is oxidative stress going on, that means that the body is stressing internally over something. It could be physical stress, mental stress, or maybe some kind of disease is going on that's causing stress in the body that we need to really address. Something like insulin resistance can really put a lot of stress on the inside of the body. So we want to look at these markers because if it is elevated, then we need to really address these with some simple lifestyle changes possibly. So the hs-CRP, this is indicative of inflammation in the body. So if there is inflammation in the body with this, if this test is elevated, the hs-CRP, then we need to look. Maybe it's coming from some bacteria in your mouth. Do you have bleeding gums? Have you been to the dentist lately? Is there some infection or inflammation going on in the mouth or other places in the body that need to be looked at deeper and addressed? Then there is the oxidized LDL, the oxLDL. That means it's oxidizing. Well, what does oxidizing mean? When things oxidize, then they start breaking down. I kind of make it the analogy like if you have something rusting, like if things oxidize, things rust and they break down. Well, we don't want the lining of the arteries to become oxidized or that because that cholesterol gets in the lining of the arteries, and if it becomes oxidized, then the arteries break down. That leads to plaque formation, hardening of the arteries, which can lead to heart attack and stroke and such. And there's also the Lp(a). This is a marker that's a lot of times could be a genetic issue. Lp(a) a lot of times runs in the family. Like if you have family members, grandparents or parents that have had strokes or heart attacks or dementia, then if you have this elevated, then we really need to get after finding out what we can do to make these changes to prevent you from having those same things. Because these dangerous little lipoproteins, small dense particles, can lead to bigger problems. And if you are having that insulin resistance, we need to talk about weight loss. Maybe you need to see about if you have sleep apnea. We need to get you moving more, eating right, and getting this insulin resistance down, because we know that insulin resistance is what causes a lot of problems in the body, such as dementia, heart attacks, and strokes. But there are simple things that we can do about this. And we can also look to see nitric oxide. Nitric oxide is the component that helps the arteries dilate. And we know that if arteries are dilated, then they can bring blood flow easier to the organs. So we can check this and see if there's something. Maybe you need to be supplemented with some nitric oxide to get better blood flow. Also, well, we want to see, well, how does this work? So this is a simple blood test that's available in office. It's most time covered by insurance. But if you don't have insurance, there are self-pay options that you can do. It's also, once we get this blood test done, then we can talk about lifestyle factors. What are you eating? How are you sleeping? Are you having sleep apnea? Are you having fatigue during the day? Do you need to lose some weight? Do you need to not sit as much during the day? Do you need more movement? Maybe you need more stress reduction types things. We also need to look, okay, maybe we need to do a good detox on you that's simple and easy to do. Maybe you need some hormones or some other things that you're deficient in nutrient-wise that we can really work on. But it's all a personalized plan because everyone's different. And not everybody should be treated the same way in the cookie-cutter, generic way of one size fits all. And when you go to a doctor and it's a quick in and out and they say, oh, yes, everything looks good, let's look a little bit deeper and find out if it really is. Because we know that early detection leads to prevention. We want to be proactive and we want to be personalized. We want to avoid unnecessary medications and we want to see how can we optimize your metabolism? How can we reduce inflammation easier? How can we protect your brain and your heart? Well, how would you want to take the next steps? Well, check out my website and see about scheduling a meet and greet. Come and book your Cleveland Heart Lab test with me today. And because my object is to keep you smarter, stronger, longer, to live longer and perform better. You can also download my checklist and see if you're a candidate, if you want to know how is your heart doing? Or if you want to look at some health guides, look on my website and check it out. And also subscribe for more tips on longevity, energy, and prevention. I'll be giving more information, so stay tuned and subscribe.